maggots for plastic surgery, like, some patients come with maggots on their legs, which isn't a good thing. But they're sort of used to debride the wounds. Yep. And so you could put medical maggots on wounds to kind of eat away at dead tissue. It's dead tissue, right? They eat dead tissue.
Selectively eat dead tissue, which is nice.
Yeah.
Thanks,
so
maggot.
What maggots do?
It's used as, wound care. You could either take them to the OR, or if they're that sick, you just put the maggots on for them to eat away at the dead tissue.
It goes back to like the ancient times.
Mm-hmm. How about leeches?
Leeches are to suck blood.
Yeah.
So like we do microsurgery, we hook up arteries and veins for our flaps.
Yeah.
But there's certain things like when people replant or place the ear back on and can't hook the vessels back up, if it's large portions, they can get congested, or fingers.
Yeah.
You put a leech on there to help with venous outflow. Until you build collateral flow.
Okay. So what the leeches do, and they usually stay on for 7 to 10 days, and it's got to have adequate enough blood flow. If you don't have good blood flow, then the leeches won't stick on. So you need to go back useless? To the operate, huh?
So it's so in the case of no blood flow, say like necrotizing fasciitis, is it useless in that case?
No. Leeches are used on.
That's not going to help at all.
Leeches are used on flops.
Okay.
Literally just venous congestion.
Yeah.
That's it.
Okay. Some people put them on the face and stuff.
Because I've seen it before. That's why I'm saying that.
So with leeches, what they do, they also secrete something to prevent blood clotting. Kind of like heparin. They got it inside. So hirsudin. Yeah. So that's one of the ways to, But you also got to worry about bacterial infections with leeches, so you're put on antibiotics. So then you got to worry about C. diff. So bringing it all together. But no, they stay on antibiotics. The leeches, usually by 7 to 10 days, you can take them off, as long as you see good venous outflow. Of course, bringing on leeches isn't a normal thing all the time, but for some pretty severed fingers, especially we just had July 4th, so firework injuries where you're going to have a tough time finding venous.
Or the veins are just too small to hook up.
Okay, that makes sense.
But if it's a large vein and you need leeches, then that vein's probably going to go down.